An invisible but deadly threat has creeped into U.S. hospitals.
It's not getting better, actually, it's getting worse.
Dr. Anthony Fauci is talking about CRE, a so-called superbug that is resistant to nearly all antibiotics. The bacteria kills half of infected patients.
Well, the first case of CRE was identified here at Johns Hopkins back in 2007. And since then, microbiologists here say that the superbug has become much more common, detecting 1 to 2 cases per week now on average.
Testing for the bacteria happens here in the basement of Johns Hopkins Hospital. Scientists take several steps to confirm the bacteria they're dealing with is, in fact, the superbug.
This is called a phoenix. When you put the microbes in there, what happens?
UV lights that goes through these panels to read them, and it would read and give you identification and susceptibilities.
The highly resistant microbes are tested again in a nearby lab.
Once it's in the broth, we use these large plates. We actually spread the organism onto the plate, incubate it overnight.
The result tells you just how powerful the bacteria is.
Wherever you see a clearing, that's where the drug is working. So this drug right here, has no zone. So that means the organism's completely resistant to it.
A potentially deadly problem for patients infected with the superbug. That means even the most powerful antibiotics can't help them. So far, 42 states have reported cases of CRE. They tend to attack in hospitals or nursing homes and infect those that are already vulnerable.
It's always a very special circumstance when someone is in a hospital and has a debilitated condition that lowers their body's defense mechanisms.
Experts say the problem is a result of doctors prescribing antibiotics too often and patients taking them inappropriately.
They ask the doctor to give them an antibiotic because they think they'll feel better, and sometimes just to satisfy the patient, a doctor will give an antibiotic, which is not appropriate. And that selects for the growth, selective growth of these resistant microbes.
The Centers for Disease Control is calling on hospitals to take action to detect and prevent cases of superbugs.
And so once you identify that there is CRE, what do you do?
Once we identify there is a CRE, we immediately call the physician who's taking care of the patient, and we also call our infection control, and because the patient has to be in isolation.
That means washing your hands thoroughly when you go into a room and when you leave a room, wearing gloves, protective equipment, gowns when you know someone is infected.
With the rising rates of superbugs, experts say doctors, nurses, and patients must take action now to prevent the problem from spreading. In Washington, Liz Wall, RT.